So what I'm going to do to begin with is I'm just going to ask Loic, my rider who's volunteered here, I'm not too keen on the treatment table, to just work in. So if you want to take your time, Loic, and just begin to ride however you normally ride your horse, that's fantastic. That's all I need you to do. So I'd like to open with a question. And that question is, some of you, I'm sure, will have noticed riders who maybe don't fit the blueprint perfect position, if you like, that we all try to achieve when we ride our horses. And you may even recognize within yourselves that you've had certain difficulties with perhaps feeling symmetrical in your stirrups, or your pelvis doesn't feel quite square in the saddle. Perhaps you find it easier to turn one way and not the other. And I'd like you to ask, why is that? Have you considered why that might be? So we'll just give the horse a little time to acclimatise. He's probably not had a flip chart and a treatment table in his normal arena. Okay, so as a dressage trainer and also as an exercise and health professional, I get lots of riders coming to me who are looking for help to improve their performance, and a lot of them are looking to improve their core stability. And I think we all recognise that to ride well, we do need good core control. And because we want to train our horses to be equally athletic on both reins, we need to be as symmetrical as possible and also able to absorb the shock of the horse's movement as efficiently as we can. And a lot of those riders that come to me, they've already invested heavily in themselves. Perhaps they've had rehabilitation programs after injury. They go to the gym, they do Pilates, they're investing in personal training programs, that sort of thing. But they're still looking for answers to how to improve. Oh, we're getting there slowly but surely. So when you're ready, Loic, and he's happy, we'll just ride as you wish. So as we just take a look at Loic riding round on this beautiful horse, I'd just like you to notice how his spine's aligned, where his legs are hanging on the horse's sides, maybe how his arms and hands are positioned. And these are typically the things that a riding instructor or that anybody who's looking to assess him on the horse for performance analysis would observe, and then they'd give him cues or instructions on how to change what they're seeing perhaps and move forward. Now, that can be really frustrating for a trainer who finds they're constantly giving the same instructions to clients. You know, I've told you enough times to get that left leg back or put this shoulder down or so on and so forth. Why can't you do it? I've told you for months. But it's really also frustrating for the client themselves, for the rider themselves. And you may recognize in your own bodies, you know, you can be trying really hard to be lighter on one rein, or you're trying to turn one way, you're trying to get more depth in one leg, and it's just not happening however hard you try. And again, why is that? Again, look at Loic, and look a little bit more closely now look at his pelvis specifically. Maybe look at his waist as he's riding around, his rib cage, the tops of his shoulders perhaps. So all those things that you're looking at now are what I call in this context extrinsic biomechanics. So anything that we can observe or measure from the outside would be extrinsic biomechanics. And there's lots of amazing kit, software programs, gait analysis tools, pressure mats and force plates that can all measure this information, weight distribution, joint angles, all this sort of thing. And you'll all be taking in different information about what you're seeing at the moment. Now, what I'm interested in is why is the rider presenting that picture that he is? What's actually going on inside with his nerves and his muscles and his joints to create what we can see? And so I really want to know that, because if I'm just taking a snapshot of what he looks like, and then I'm giving him exercises to improve his posture, or maybe even core stability exercises, but actually he's got a functional leg length difference there that I'm not aware of, or maybe the muscles around his pelvis are behaving in such a way that his sacroiliac joint actually isn't able to absorb the shock of the horse's movement properly. At best, I might be suboptimal in what I'm asking him to do, but at worst, I might be exposing him to risk of injury. So what I want to do is assess his intrinsic biomechanics as a base point, so I can get a profile of how he's working at this point in time. So in a moment, I'm going to ask him to dismount, and I'm going to get him to get on my table now the horse has settled down. So intrinsic biomechanics for me is really important, because when I'm coaching a rider, or when people have been sent to me by their instructor, they've often been battling with the same issues for quite a while. And if we think of a rider who maybe sits a little bit like this, we can take a fair guess that their intrinsic biomechanics perhaps aren't going to be working the most efficiently. And therefore, we need to be profiling them and seeing where we can start with them. And as I said, it is very frustrating for riders when they're trying to make those changes, but actually their intrinsic biomechanical behaviors mean that they really actually can't make those changes that the instructors, or even somebody just observing them, like a Pilates teacher, for instance, they can't make those changes and make them stick without other compensatory patterns happening. So really, it's just about, can we be more efficient in what we're doing? Now, we could look at a rider that sits with that blueprint position. I'm sure you've observed much skillful riding going on in the last day or so. But again, should we assume that because somebody is creating a textbook-looking position, that they're actually performing really efficiently on the inside? No, we shouldn't assume that, because what we often find with athletes and experts in any sport is that what they're often experts at is cheating. And that's what they do. They're able to create an organized looking picture on the outside because they're effectively managing to cover up what's on the inside. But could actually we be better and help improve their performance even more if they can work more efficiently on the inside? And actually, could that then help the horse underneath them to move more freely and more expressively? So the process that I'm going to show you just a snapshot of in a moment has been developed from studies that we've performed using isokinetic machines and lumbar motion monitors, and we've put together a process of screening protocol that correlates most highly with the results that were shown in those studies in terms of function and movement. So they're not clinical in any way, it's purely biomechanical. Some of them have been derived from a clinical therapy background, but this is purely biomechanical. And where I fit in is that I'm not a clinician, but I hopefully can help to bridge the gap between riding instructors and health and exercise professionals and clinicians who are all working towards the same goal for rider performance, but we can start cueing better and prescribing better in terms of exercise performance. So the screenings that I'm going to show you, I'm just going to show you 4. There are actually 43 screens in total, the process that I use. But for time constraints, obviously, I'm not able to show you that. But I'm going to ask Loïc, is it okay if you can dismount and hand your horse over to your helper, and then we'll get on the table? That would be great. I'm not sure whether you all thought the horse was going to have to jump that table like they did yesterday, but no. Hello. So what I'm going to ask you to do, Loïc, is just take off your jacket and your boots and your socks and your hat. That's all, though. That's all. I don't think Loïc knew he was going to have to take off his clothes for this, but... I'm going to have to move that because I need that stool. That's okay. All these technical bits of kit, you see. Thank you. Thank you very much. Socks too, and hat. Thank you. So if you just have a seat on there. Oh, hello. Okay. Can I just get you to spread your hand out very wide as you possibly can? Okay, so I just need to take a measure of that, that's all. Okay, thank you. So I'm going to, if you want to take the horse out of the arena, that's fine. We don't need the horse anymore. So what I'm going to do is I'm going to show you 4 screens with Loïc, and then I'm just going to write the results up on this little poster here. So you can see that's the list of what we do. We look at the pelvis, the pelvic function. We look at how the nerves, muscles, and joints in the pelvis and the spine, the shoulder, the knees, and the feet are working in a full screen, and also core ratio testing as well. And this process has been used across a lot of sports up to Olympic level. And the findings have already been presented at a number of international conferences, including the IOC World Conference for Injury Prevention in 2014, and also several isokinetic conferences in Madrid and Oslo and South Africa. So, Loïc, if I can ask you to lie down on the couch. You weren't expecting to do this, were you? So I'm going to have to talk Loïc through what I'm asking him to do, and also sort of talk to you about it at the same time. So I'll put all my pens down. Loïc, I've got to make some little marks with my pen. Is that okay on your ankles? Okay, great. So all I'm doing is I'm marking his bony landmarks here, so I can assess whether he has got a leg length discrepancy, which may or may not be of any interest, depending on what it shows. Okay, Loïc, can I ask you to bend your knees so that your feet are flat on the couch? Yeah, so just bend your knees. Okay, and then keep your head down. Okay. Can you now lift your hips up to the ceiling? I might need some French translation. That's it. Bit higher. Perfect. And then pop them down again on the couch. Excellent. Okay, I'm just going to come around here because he's a little bit tall for me to do this. Okay, I'm just going to bring your knees up. Okay, and then stretch them out again. Relax, relax. He says, what? Relax? There's 300 odd people watching me lying down on a couch in a school. Okay. So if anybody near the front, don't come from the back because this will take you too much time. If anyone wants to come and look at this, you're very welcome to do so. But I'll just tell you that he has a 5 millimeter leg length discrepancy. Oh, brilliant. Come and have a look.
Oh, wow.
Yeah, so the left leg, oh, he's lifted his head. It's all right, put your head down. Start again now. Okay, so the left leg is shorter than the right leg by 5 millimeters. Now, that doesn't give me much information at the moment, apart from the fact that there's a leg length difference. But I want to know whether that's just because something stuck somewhere in his body. And if it is because just something stuck somewhere, that means it might be very easily changeable. So, purely for the purposes of the demonstration, because we haven't got time, I'm just going to carry on, okay? But normally, because he's lifted his head up, we'd have to start again. So I'm just going to move your legs around, okay? So all I'm doing now is just seeing whether what should happen in his pelvis as I do this screen is happening. This particular screen is being researched at the moment in a PhD at Chichester University. Right, it isn't, this left side at the moment is not working as it should be. So I'm just going to write that on my little chart as a positive sign. What should happen if the pelvis is functional in this screen is his leg length should change in direction, either longer and then shorter again, or shorter and then longer again. By the same amount, and it didn't. So that shows me that that left side isn't quite working as it should be. Again, if anyone, same lady, wants to run and have a look, be quick. Right, this right... Sprint. Yeah, it's just stay here, that's fine. You can be my monitor. So can you see that that right one's gone shorter than it was before? Okay, so I'm just going to do the same thing again. There we go. Okay, have a look again. So it's shortened, and it's shortened again from where it was. So again, there's a restriction in normal movement function on both sides. And this is typically, we typically do find this with riders. I'm just going to write down what actually happened. Okay. Right, next one. I have to go really fast now. Louis, could you put this side of your ankle on this side of your knee? That's great, thank you. Apologies, my back is towards you. I'm just going to pop that there. I'm just going to stabilize your hip. Okay. Could you possibly pass me my ruler, which is down there? Thank you. So you're glad you got up now, aren't you? Right, just relax this down, but without forcing it. Perfect. Okay, so I'm measuring to the side of his knee. And that is, good grief, this is a very strange ruler. 24 centimetres plus 13. Okay, uncross that for me. It is a weird ruler. It's the only one I could find. So, where is my 4-sign test? Left, so that's 24.3, 240.3 millimetres. So I'm just assessing, I'm assessing range, but I'm also assessing symmetry. So I know whether his hips and his pelvis are capable, actually, of being symmetrical in the saddle. So if you can do the same with this side, that's great. He's ahead of the game now, you see. Okay, and then do the same thing. Oh, there we go. Now then, I'm nearly at the end of my ruler there. This very, very odd ruler. Okay, so that's 30, 28, 29, about 29 centimetres. Thank you very much. So there's an asymmetry there. There's an asymmetry there, which about 5 centimetres, which is quite significant. So I'm going to, that's fine, you can, yeah, you might need to come back in a bit to check. So what I'm going to show, if you just put your hands on your hips for me as well, just there, that's great. I'm just going to check his shoulders. I don't need that stool after all, I haven't got time. So I'm just finding a bony landmark that I'm going to use to assess whether he's actually able to keep his shoulders in the position that we'd want. And I've got my fingers on the acromion process, which is part of the scapula. Now for me, this should be no more than 2.5 centimetres away from the couch. And we would look in the field, sort of doing quick tests for about 2 fingers. He's got 4 fingers on the left and 5 fingers on the right. Okay, and then if you just relax that, that's fine. So again, that would constitute a positive test for restriction in the pec minor. So for riders, that's quite significant. There's very often a biomechanical link between the pelvis and the shoulders. And if riding instructors are asking people constantly to change their position of their shoulders, that's very difficult if the muscles in the shoulder are behaving in such a way that they're actually stuck forward like this and they're not able to change. Positive results in that test, really common with riders because we're spending a lot of time with our hands in this position, mucking out and so on and so forth. But general modern living with lots of sitting and computer work and driving and all that sort of thing can contribute to that as well. Just come into a sitting position for me. Swing your legs over this way. So we're proposing that rather than starting with functional exercises or even core stability exercises straight away, what we should do is start with a process to normalize the body's biomechanics before that. And hopefully give some exercises that will help him to improve the function of the pelvis, because why would we want to start stabilizing somebody in the wrong position? So from that base point, and as I say, there's a huge range of assessments that we use, we can start to then build on from there, and we have the view that the strength and conditioning programs can then stabilize after the body's been normalized and then move on to what we would call functional exercises. So I'm going to show you how to do an exercise, Loic. Is that okay? I can come and sit next to you now. You can do it with me if you want. Right, it's very easy. You can do it in your seats. So this is called the 4-sign exercise, and it uses a process called post-contractory sensory discharge, or autogenic inhibition, which has been researched by Ribo Siskar and Jiří Dvořák as well. So what you're going to do, which side were you most positive? The right side, weren't you? Just cross your right hand, right leg over your ankle. Now you're going to have to bring that a bit further over. How does that feel? Is that okay? Are you comfortable in that position? Right, I'm going to use my hands to help you with this. So I'll come over here. So what we're going to do is you're going to push your knee into my hand and your ankle down into your knee, but only with about 20% of your maximum effort level. Is that okay? So to find that maximum effort level, you push as hard as you can into my hand. Okay, so push up as hard as you can into my hand. This way. That way. Okay, so push hard as you can. Right, now release that by about half, so only half as much pressure. Okay, about that? And then half that again, so smaller, smaller. Okay, got it? Bit more, little bit, less. Okay, hold that, right. Push. Okay, gently. We're going to hold that for 20 seconds. So I've got to keep my pressure and time this, multitasking. Stay gently, that's it. Getting the 20% is quite the difficulty with this. Okay, and then uncross your leg, wiggle it round, and then do the same again. Okay, same again, gently. Right, so that's what I view to be about 20%, so I'm going to time that again. We're going to do 4 lots of 20 seconds. That's what we found in our studies to be the most efficient time frame. Gently. He's constantly changing his percentage here, so we'll see what happens. Okay, release. Little wiggle. Same again. Okay, ready? Excellent. He's got his 20% sorted now. Is anybody doing this, by the way, while they're sitting there? Some of you. Hey. On the back row, see. It's quite boring, this, waiting for the 20 seconds. Sorry about that. Okay, uncross. One more time. Once more. Okay, you ready? Yes. Up we go. Gently. Okay, so this test is, the 4-sign test is an adapted version of a clinical test, but it just, it helps to assess hip rotators. And there have been studies to show that asymmetry in hip rotators can lead to back pain. Okay, release. And that was done with a study of judo athletes, but also that asymmetry in hip rotation, range of motion, can reduce muscle power. Now that's interesting for us as riders, because one of the functions of the piriformis muscle, which is one of the hip rotator muscles, is actually an abductor of the flexed hip. And when we're riding, we're in flexion, we're in abduction. And if that is not working as well on one side as it is the other, then that makes it exceptionally difficult for riders to stay central in the saddle. Okay, so have a lie down. We've only done one side because of time. Yeah, it doesn't matter. So I'm just going to see, just with doing that release, if that has made a difference. And if it has made a difference, then that means that we need to start Loic's program with releases rather than other exercises. Okay, so if you put your feet flat again, bend your knees. Thank you. And then lift your hips up towards the ceiling and then down again. Great. He's got this motion sorted now. Relax, 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 relax. Okay, who was my lady that was coming to have a look? Okay, so his leg length difference is about 4 millimeters now, not 5 millimeters. Would you agree?
Yes.
It's a little bit less, but that's maybe not the most significant thing. We may or may not find a change here. I'm going to just do that testing again to see what happens. Can you still hear me? Yes. Okay. Okay, that's shortened. Mm-hmm. Lengthened again by the same amount. Yeah? Okay, so that's what it should do. It should shorten and then it should lengthen again by the same amount. So by doing a release on the right side of his pelvis, the left side of his pelvis has improved in its function. Relax, Loic. Are you a dressage rider? The dressage riders, they won't give you their legs. Okay, I am one, so I can say that. Yeah, so bang on level now. So that has shortened. Now, will it shorten again? Because that's what it did last time.
Interesting.
What did it do?
So this has gone down.
This has gone down. So it's actually gone back to where it was. So it's shortened and it's lengthened again, which means that side is now fully functional on that particular screen. Okay, so I just need to recheck. Sorry. Can you be your official holder of the ruler? So if you can put this side of your, it doesn't matter that he's lifting his head now, by the way. Okay. So I'm just going to let that knee relax. Okay. Right, that's less. That's why I measured his hand span, by the way, earlier. That's released. Oh, I love it when this happens in demonstrations. That is now. That is my one-to-one, isn't it? That's 17 centimeters now. Can you see, by the way? Can you see there's a visual difference between that first 10 minutes? I've got 10 minutes to go. Okay. Okay, uncross this leg. Sorry, I talked for a long time about this. So, and then we'll do the same thing this side. So that's released on that left side. Remember, we've only released the right side. Okay, and then let that one release as well. This is some sort of construction ruler.
It is.
Let me drop that down. That's released to, good grief, 0. 22, what do you reckon, would you agree? We're looking at the furthest, yes, exactly. So we're looking at the side of it in 22. Yeah, fantastic. Thank you, Louis. You can uncross that. It's much more even. It's much more even than it was. We're looking for 19 centimetres, really, because that's about his hand span, so that's the sort of range we'll be looking at. But that's released by 7 centimetres on his right side. Just put your hands on your hips. So I'll just see if there's any difference. You won't need to go for a jog tonight, will you? Okay, so remember we've only released the right side of the pelvis. Now, did you see me do this before?
Yeah.
Yeah, so we're now, same point, same bony landmark. We're now even both sides. I can get 4 fingers under that bony landmark on both sides. And in fact, the right side is now slightly more released than the left side. And that's from doing 1 pelvic release. Okay, you can come up to sitting. So, to conclude, that doesn't always happen, by the way. But just from doing 1 side of his pelvis, all those things changed. So if I just mark that out on my little thing I've got here. Good job, the horse has gone. So we do have a leg length difference with the left leg being shorter than the right leg. And we also had positive results on this particular screen on both sides, but it was more positive on the right side because that leg shortened and then shortened again when I did that screen. His right side four-sign test, which assesses more of the, it's still a pelvic function test, but it's more of the hip rotators. And he also had a worst result, both sides restricted, but worse on the right. Now you can see all the other boxes that I would normally fill in here. But we have a collection of pens that don't work. A collection of results more on the right side of this rider's body. Now, I didn't show you the thoracic rotation test because I didn't think we'd got time to do that. But that, again, thoracic rotation can be influenced by pelvic function, functional leg length differences, and what riders commonly report is that they find it easier to rotate when the pelvis is moving more freely. Did you feel anything, by the way, Loic, while you were doing? You did feel something. What did you feel?
More easy after the exercise.
Oh, right. Okay.
More liberty.
Okay. So he just said it feels easier after the exercise and it feels freer in his pelvis. So again, for him to now go and get on his horse with that degree of difference in his ability for his pelvis to function properly, there was only a 1 millimetre difference in his leg length improvement, so there was still a 4 millimetre leg length discrepancy. But again, there was still some restriction there, especially in these 4-sign tests, which is that one. But repeated use of that exercise could well take those tests down to a negative result. So he's going to be more able to absorb the shock of the horse's movement. He's going to be more able, hopefully, to use his pressures more evenly, and that might have an ethical implication. So application and removal of pressures and the timing of those and the ability to apply those and release them in a practical situation is really important for me as a riding instructor. If we can get all this working better, that has an impact on the contact that people have with the mouth. And overall, I think this is a really helpful approach, and I'm doing some research specifically on an equestrian project with this next year. It isn't reviewed as a whole, but each screening has evidence behind it. Okay, thank you very much.
Okay. Quick questions.